Children with idiopathic toe walking and spastic diplegia who demonstrate toe walking may face challenges as they're growing and developing, as well as later in life. They may develop a contracture or muscle contracture where they lose range of motion at their ankle. Traditional serial casting works by gradually increasing the range of motion at a child's ankle. So each week they'll have a cast placed on their ankle. It looks like a cast as if they broke their foot.
One of the barriers that we have with serial casting is skin issues. If they develop any skin problem, we can't put them back in a cast 24 hours a day, 7 days a week in a contained system. So we have to give them a break from that. And it would kind of slow the progression of our casting. They might be out of a cast for a week or 2 weeks until they healed. So once we had this removable casting material, we thought, could we make a cast that's removable and they could do some standing and walking in it? The bivalve cast was something that we could not use for walking. It wasn't stable enough, so we started exploring the options. What inspired us was the fact that we had a new product to work with, the removable casting tape. It was originally presented to us as a type of material that was used for splinting, which was perfect for holding our foot or our ankle after casting. So we started incorporating it. We started with some of our smaller, younger, lightweight patients to see how it would hold up. We had success. We saw improvements in range while they were using it. Their skin was healing. And so we were able to start trying some of this removable casting with some of our more medically complex.
What's great about removable serial casting is it allows access to care for children or families that can't tolerate the traditional casting for whatever reason. It might be pain, it might be a medical reason, or it might just simply be distance. It allows more people to access care, and we know that the removable casting based on our research study is effective. What inspired us to do the research study was that I had seen some patients come to clinic with these removable serial casts that our therapists were doing, and it looked like it was working, and I saw that these kids were improving their range of motion, but I didn't have any data to prove that. And I didn't want to continue to recommend something that I didn't know was effective based on data. We decided to do a retrospective review of the patients that had been having removable serial casts to see if it was effective and see if it was safe.
The typical things that you study is improvement in dorsiflexion range of motion, how far we can bring the toes up and stretch the ankle. When we see the improvement in the ankle dorsiflexion range of motion, that translates into the improvement in gait. We are very fortunate here at Mary and Joy to have a gait analysis system called the Xeno Walkway. It's a plantar pressure mat that will record each footstep that the patient takes. We have 2 cameras to videotape how they're walking and compare it to what we're seeing on the mat for analysis. It is a very efficient and effective way to gain objective measures on their gait mechanics and how they're walking. When we're done casting, we take another measurement of their walking on the mat at the end, and we can look at the changes.
I was very happy to see that it was an effective method to improve range of motion, just as I was seeing in clinic. The next steps of our research project, looking at serial removable casting, is to distribute the information that we've collected so other people can see that this method is effective, and then considering a prospective study to look at how these children do over time.